Dr. Mitch Schwartz. Dr. Schwartz is the President and Chief Medical Officer at Lumenis Health System. Dr. Marcosi.
Thank you, Fran. Governor, thank you very much for allowing us to speak here today. I think under your leadership, Maryland is a safer state as a result of the significant actions you put in place, the early actions you put in place to protect our state from this virus. I'm here to talk to you about how the healthcare delivery system is working aggressively to ready ourselves for this virus and the potential surge of patients that we may be seeing. Governor, you asked us to build 6,000 beds, and we're working and we're standing in one of those federal medical facilities that Johns Hopkins and the University of Maryland Medical System work together in partnership with the Maryland Department of Health, the National Guard, the Baltimore City Emergency Medical Services to stand this up to make sure it's ready when and if we do have the surge of patients. Other healthcare systems across our state continue to have readiness built into what they're doing on a daily basis. Lumeris, MedStar, all of us are working in collaborative efforts to address the potential capacity limitations that we may feel as a result of the burden of disease and the illness that may be presenting to us over the course of the next few weeks. Now is a time for readiness, and I think, Governor, as a result of your leadership, you've demonstrated to us the actions that we need to put in place now to make sure our state, our healthcare system, responds optimally to this event and to this crisis. 3 specific things we're putting in place. One of them is building surge capacity within our hospitals. The second is sites like this, which are external to hospitals, but allow us to decant our hospitals so that the lower acuity patients can be moved to facilities like this, so we as hospitals can make sure we have the capacity to meet the demands of those who are severely ill. And lastly, Governor, you asked us to meet these strike teams, and we are building right now efforts to make sure a doctor, a nurse, a team can go out when you request them to make sure that we can stabilize patients right at location to make sure, number one, we can test, we can do the right assessments, and number 3, we can provide the right medical care on site to the folks who may need it at long-term care facilities and SNFs. So thank you very much, Governor, for your leadership, and we look forward to partnering with you throughout the rest of this response to this crisis.
Thank you, everyone, and specifically thank you, Governor, for allowing us to stand by you as you manage this pandemic across the state of Maryland. My name is Mitch Schwartz. I'm the president of the Lumenis Health Clinical Enterprise, and I come here to speak about a pandemic based on a virus that is cruel, that impacts all of us, whether you're working at a hospital, you're staying at home, or you're an essential worker in our workforce. It is times like this when we need to coordinate care with our government, local, state, and federal partners. At Lumenis, we have a critical priority, and that is to safely staff, supply, and equip our hospitals to provide care to our communities. We were formed last July, the merger of 2 hospitals, Doctors Community Hospital in Prince George's County and Anne Arundel Medical Center in southern Anne Arundel County. We have 9,000 employees and hundreds of physician offices throughout the area. We'd like to actually give you 3 specific ways we're managing care in the community during this pandemic. First, we have scaled our telehealth abilities dramatically. All of our patients were told to stay at home, and it is our priority to provide access to them during this pandemic. We still have access when face-to-face interactions are required, but we have scaled telehealth, now doing thousands of visits a day. Secondly, we are closely working with local, state, and federal government and partners to prepare for what we believe to be a massive surge in volume over the next weeks. We have looked throughout our hospital facilities to develop space typically not used for patient care, and redefine care process to enable our staff to care for all of those patients safely. And third, we have developed a massive plan of redeployment for our medical staff, nurse practitioners, physician assistants, and nurses, retraining them to provide care for that patient population that we believe is coming. So in summary, we have a plan, we are executing that plan, and we want to safely provide patient care with appropriate supplies and equipment at our hospitals. So I want to thank you, Governor, for allowing us to support you. And I also want to thank all the healthcare workers throughout the state, all those workers who care for patients and, more importantly, care about them as well. Thank you very much.
I just want to again thank all three of these great doctors and their healthcare systems, but all the others that also serve on our response team. There are a number of other ones that aren't represented here today, but they've been incredible. We also have, obviously, we have Deputy Secretary Fran Phillips, who's been a leader. You've seen her at every one of these press conferences. And we have Major General Timothy Gowan from the National Guard here with us as well. Our team at the state level has done an incredible job, and I talk to our state leaders every day. I talk with these smart doctors from all the hospitals. We talk to a bunch of other folks, but you don't see all the stuff going on behind the scenes, but let me tell you, every one of these folks is a superstar, and they've been stepping up, and all the people that work for them are incredible, and we want to just appreciate their teams and all the folks at the hospitals, the doctors and nurses and technicians, all the people in the front lines, but there's an awful lot of other folks too, our citizen soldiers of the National Guard, all the people that work in the health department, every one of our agencies, the folks from DGS and all of our other agencies that work so hard to put up this facility, and everybody else. I just want to say thank you to them. With that, I'll take a few questions. Well, maybe I'll let one of the experts like Tom come back and answer that hard question, but that's going to be the hardest question of all. And what we've got to do is do a lot more testing, and we're going to have to really study the numbers day to day. The last thing we're anxious to get everybody back to their normal lives as quickly as we can, but the last thing we want to do is bring them back too fast where we just ramp this thing back up and have the virus spread. So we're going to rely on those experts. I don't know if Tom, you or Marco, any of you guys want to touch on this. There's a lot of smart guys that can probably give you a better answer, but it's going to be a really hard decision based on the data, and we can't really give you a specific time yet, but maybe any of you guys want to take a shot at that one? We have these smart doctors, you might as well get a good answer out of them, even though none of them want to give you the answer.
Well, I certainly agree with what the governor just said. I think in other countries, they're beginning to experiment with easing social distancing where they've had measures in place. For example, in China, they're now beginning to reopen public transportation and have people travel around more than they were allowed to before. I think one of the preconditions is getting numbers down quite low, never to zero probably, but to a very low manageable number so that public health departments can be aware of all the cases in the state and can try to manage them, can isolate them, track their contacts. So it depends on the capacity that we're able to build in the state to try and get control of that. We also have to have, as the governor was saying, really, really available diagnostic testing so that people, even with mild symptoms, can be diagnosed quickly and can be put into isolation. That's not quite possible yet, but that is being ramped up in the state. And finally, we really need to prepare our healthcare system so that if there is a surge in the future, that they're never in this position where they are so short on masks and short on space and ventilators. So we have to be ready for that too.
Doctor, what is it with the masks and the personal protection equipment? Why is it so tough to get? Is it because the hospitals don't have enough on standby? The federal government, because we've heard a lot about this personal protection equipment. Why don't we have it?
Marco, why don't you answer that question? Because you're in the
Yeah. Thank you for the easy question. So I think it's all of those. I think that we have a limitation with regard to how our nation, the importing and the ability to actually get the personal protective equipment. We're looking at across whether or not we have the national capacity to be able to have that, as far as be able to produce it, and or imported into our nation. There are all limiting steps with regard to it. In addition to that, the healthcare delivery system has to respond to a surge of patients. So obviously the burn rate is higher to be able to respond to an event like this. All those factors cascade into making sure we have enough personal protective equipment for our nurses, our respiratory therapists, our doctors, our frontline EMS providers, to make sure that they are the right people who have the right personal protective equipment when they do need to respond. So it's all of those pieces go into factoring to making sure that the personal protective that the responder has on is right, and they have it throughout the entirety of the event.
So it's a really difficult question. The question is how bad is it going to get? Are we going to need all of those things that? So FEMA put in those requests based on, I believe, what they felt was a worst case scenario, and they're taking steps. Had we not instituted all of the dramatic and unprecedented actions we've taken over the past 32 days, based on the models that we're hearing about from smart people like Dr. Birx and Dr. Fauci and all of the modeling, if we just let this run its course and we had the spike and overloaded the healthcare system, then we would need those kinds of numbers, and the death rates and the infection rates would be astronomical. We believe, and I think these smart doctors would agree, although we don't have exact numbers, that we have dramatically lowered the potential for that, both hopefully in America, but particularly here in Maryland, so that worst case scenario is not going to happen. We don't know exactly, how many people are going to be infected. We don't know how many people are going to be hospitalized or how many deaths. But at least my hope is that we're not going to get near the worst case scenario, that it's going to be hopefully a lot closer to a best case scenario. But I don't know if any of you want to take a shot at that. Did I handle that one? Yeah, it's your turn. Yeah, we'll take 1, 2, 3.
Thank you, Governor. So I think all the actions taken by the governor have depressed the peak of case volume, and that saves lives, particularly when hospitals could have been overwhelmed in a way we hopefully won't. But I think we have to recognize that when the peak is lower, the spread of time is still significant, and the resilience of hospital workers, healthcare workers, is going to be called to the table. And
Yeah, actually, I'm not sure the validity of that report. There have not been 2 ice rinks that have been leased. I know that was a possible consideration, but there are no leases signed on any ice rinks. I know that's a possibility of maybe 1, but it's not, actually has not happened yet. But that has happened in other places around the world, and so it's just something that is being considered, but it was a false report to say that two ice rinks had been leased. Well, let me follow up on what the doctor just said. It's important. Had we spiked and had all of this stuff right away, it would have been overloading the system, but it also would have happened faster. So when people are saying, how fast can we get over this? The fact that we've dampened down and flattened this curve means it's a longer period of time, and we have this longer plateau. So while we're going to not have this overload of the system, it also means it's going to take a while for us to be able to get back. It's going to take a longer period of time, but not be as bad, which people are going to have to get ready for that. Anyway, the testing continues to be the primary frustration. Our state lab turns around the testing within 24 hours. Many of the other labs had a backlog, and they were taking up to a week. I think they're now catching up to speed. Maybe Fran can address this. But the rapid testing that you keep hearing about being announced, about 45-minute testing and 5-minute testing or 15-minute testing, is coming, but has not come to either Maryland or just about anywhere else, I don't think.
Governor, in your conversation with the Vice President, what was it that convinced them that this was a top priority? And who made your mask you have them, and what's it like to wear one?
So the mask that I was wearing was made by prisoners at the Maryland Correctional Facility, and they're very happy to be doing this and to be a part of the solution, and excited to be, in some way helping their fellow Marylanders. So this was something that Secretary Green announced at our last press conference, and he gave me one of these masks, and I wore it today. I just took it off so I could talk, as you can't hear very well when you're muffled, but I'm going to continue to wear that. It's just a cloth mask. It's not the N95. It doesn't take away from healthcare workers, but it does do some of the basic protections that you hear about. How did we convince the Vice President? I can just say that, beginning about almost 2 weeks ago, I started placing calls to everyone in Washington and ringing every alarm bell that I could ring about what all of us were talking about and the numbers we were starting to see, and that while we were focused, they were focused on New York and New Orleans and other places, that don't forget about this right here. And my argument was that the Baltimore-Washington corridor and that we were so critical to the nation's defense that it was not just the fact that we had numbers, but that they should pay attention to the fact that I included Maryland, D.C., and Virginia together because it's 400 and some thousand federal workers that they relied on, and it was surrounding all of them. But I put a place to call to the president and multiple calls to the vice president. I talked to Admiral Giroir. I talked to the head of NIH. I talked to Fauci. I talked to Dr. Birx. I mean, I was calling all weekend, late into the night, almost every day for a solid week. And in our last call, the vice president started the thing by talking about he called me this past weekend, said we're going to make Maryland and D.C. a priority. He started the meeting with the governors yesterday saying Maryland is a priority. Dr. Birx then went into a 10-minute discussion with all the governors about each of our counties and what they were going to do. So I think they were looking at the numbers, and the numbers justified what I was telling them. But there's no question. Dr. Fauci I had a conversation with, and he said, I'm leaving as soon as I'm in the parking lot at the White House, about to walk into my coronavirus thing. I promise you I'm going to embrace this again. And he hung up the phone as he was parking his car and went in, and, I must have made, 30, 40 phone calls about this. Spent a couple of weekends doing it.
Governor, this has caused tremendous hit to state revenues. Do you anticipate large cuts to state government or layoffs?
We're going to be talking with our budget folks. I don't anticipate. I'm hoping we're going to avoid major layoffs, but there's going to be massive budget problems. I mean, I imagine we're going to. I think we're already at the point where we've spent probably somewhere in the neighborhood of $1 billion to $2 billion, which is a pretty big number. So yeah, there's going to be massive budget problems for us, for every state in America, just like there are major budget problems for individuals and small businesses and large businesses and for the federal government. Yep.
I can verify that all of us have limited elective surgery in a dramatic way. We are not doing a purely elective surgery. I can also tell you, as I described, that we are planning for a substantial surge in volume, and we are redeploying and retraining all of those employees to provide care during that surge. No.
Got a lot of questions, Aaron. I mean, I can't. We've spent money everywhere in every single agency, but I can't really tell you exactly where it went. We could probably follow up at a later date. But right now the idea is to keep hundreds of thousands of people from getting infected and stop 10,000 people from dying. So we're not counting every dollar that's being spent.
Governor, would you shed some insight into the decision to provide a racial breakdown of tests? And why did it take so long? Other states and cities have done it.
Well, no. The federal government does not do it. The CDC doesn't do it. None of the national testing labs do it. And just in the past day or two, a couple of cities have said they would do it, but they aren't really doing it. Like I think DC said yesterday they would do it. A tiny portion of their numbers they are doing, which is, but we'd be happy to do it. We do about 500 of our tests. We can do that easily, but the other 25,000 tests, doctors send them to national labs that aren't in the state of Maryland, who don't keep that kind of information, that aren't required in their state to keep the information, that aren't required by the CDC to keep the information. And so it's hard for us to gather the information. We're going to try to do that, but the last thing I would want to do is to have, all these tests. People say we're not going to go to Maryland because they make us do something we don't do anywhere else, and then people would start dying. So we're going to do our best to keep track of the information without killing people.
Last question, please. Oh, I have another one.
No, I think you're done. Anybody else? Luke got 1, you got 10.
If and when we do lift up on social distancing, what's the likelihood that we would end up having to return to it?
Well, that's a good question. We talked with the doctors today about that. Look, I think if you notice the way we did it over 32 or 33 days, we ratcheted it up. We took this step and then that step and then the next step and the next step. I think we'll ease back into things. It won't be like we'll flip a switch and now everything's back to normal. We'll have to slowly start to make decisions based on the facts. But it's not going to be like everything's great tomorrow. When we get back, we're still going to be careful. We're still going to limit. We're still going to have to institute social distancing. It's a good idea. People will still be wearing masks. But we want to make sure we don't go back to it becoming a problem again. So we're going to be really cautious. The decisions on reopening and getting back are going to be even more difficult than the ones that we made to close things down, which were extremely difficult. Thank you all.